I certified where food is fortified.
This program is presented by Smart Bazaar.
नमस्कार. प्रुडंट मिडियाच्या हॅलो दोतोर कार्यावळींत तुमकां सगळ्यांक मनाक काळजासान येवकार. तुमकां येवकार दितना आज आमची जी तज्ञ दोतोर आसा ती सामकी खाशेली ह्या खातीर की शी हॅज कम ऑल द वे फ्रॉम दिल्ली, फ्रॉम लेडी हार्डिंग मेडिकल कॉलेज, आनी थंय तांचें शिकप जालां. आनी तांचो जो विशय आसा तो म्हणजे कॅन्सर जागृताय, कॅन्सर अवेरनेस. आय हॅव विथ अस डॉक्टर मोनिका पुरी, जी ह्या विशयांतली तज्ञ आसा, जाणकार आसा. डॉक्टर, वेलकम, नमस्कार. So, as we are going to talk about cancer awareness, the first question which everybody's mind or everybody thinks of is what you mean by cancer. Let's start with the basic.
Sure. Cancer in a very layman terms really means abnormal growth of any body cell. It could be blood cell, it could be tissue cell, it could be any tissue, any cell of your body which is showing abnormal growth beyond what is expected in a normal is called as cancer.
Yeah. Okay, then I have got an important twist over here. Even we have got something called benign tumors. Again, there is a growth of the cells. So how you differentiate between benign tumor and a cancerous tumor or cancerous growth? And what are your differentiating lines and what are your cutoff points here you have to take care?
A very good question, because everyone feels that when they have cancer, that means it is malignant and it is the loss of life. But cancer is actually divided into two parts. One is benign cancer, as you have said, and other is malignant cancer. So when the growth, that abnormal growth is limited to that particular part of the body, and it is not showing abnormal other signs which are leading to, loss of appetite, loss of any bleeding from any part of the body, or any abnormal other symptoms, then most likely it is localized abnormal growth, and that it can be cured is benign cancer. When it has already shown very massive spread in other parts of the body, and it has led to involvement of lymph nodes, involvement of other organs of the body, then it is called malignant cancer. But how do we define them scientifically? Then there is a staging of the cancer we called stage 1, 2, 3, 4, and it all depends on many diagnostic tests which are done to finally agree to what stage of the cancer is. And usually we have seen that grade stage 3 and 4 are more malignant and deadly, but stage 1 and 2 are something that can very much be cured also.
Achha. Can be managed, you mean to say?
Yes.
So, म्हाका दिसता एक खूब महत्वाचो विशय आसा, आनी आय एम रियली वी आर फॉर्च्युनेट टू हॅव सच अ great personality, public health specialist, and दुसरे म्हणजे तांचे she has worked with WHO in past, so a person who has got concrete knowledge of the subject. So doctor, one more thing I want to know, because nowadays India is becoming a hub of the cancer patients. Unfortunately, among them, most of the patients are of breast cancer and CS cervix. So what is your take on this? Because why is that breast cancer or CS cervix patients are increasing or they are at rise? Is it because of the early diagnosis, or is it really the number is increasing? What is your take on this?
First of all, let me also burst another myth that people think that cancer is something that they are probably born with.
Correct.
No. It is not something always that you are genetically born with. Most of the cancers and their growth is very much dependent on your lifestyle.
Achha.
What kind of lifestyle you are living, what kind of food you are eating, what kind of exercise pattern you have, what kind of predisposition you have to certain, risk factors, and that define whether a person will get very malignant cancer or not. So to your question, why breast and cervical, I think in India specifically these two women cancers we have never put a lot of focus on. And women, most of the time, they're so busy taking care of their families that they even forget taking care of themselves.
Yeah.
So something like breast cancer, that women can actually examine on their own with a very simple tip. So we call it self-breast examination.
Absolutely.
And if they do it early, they will figure out if there is any abnormal growth they are feeling in their breast, any lump that they are feeling, and they can immediately meet the doctor.
Absolutely.
So to your point, is the number increasing? Definitely yes, because our lifestyle is also becoming very sedentary. Our dietary habits, where we are pushing to have more red meat, more fatty food, leading to more, overweight, all those things, not taking food products which are rich in antioxidants, which fight cancer. So, plus better diagnosis, that has led to overall increase in number of cancer cases. So not that cancer was not there earlier, it was, but we were not diagnosing it enough. At the same time, our lifestyle used to be much better. If we talk to our grandparents, they were more fit. But we are so hooked to watching TV, Saas Bahu every day. We are so hooked to not exercising but being a couch potato. Obviously, the number is going to rise.
So, and one thing is our stress. Day by day, I always say that mind is supposed to take a rest and body is supposed to work. Presently, we are doing exactly opposite. We are putting body to the rest and mind is working and jumping at so many things, right from the TV to your mobile and your friends and boyfriends, girlfriends and WhatsApp news and whatnot. Every day there is one new thing. Somebody said you should not drink water while standing. Somebody said you should drink water in this. A lot of things. So people get confused and they enjoy being confused. Second thing, as you have rightly said, our lifestyle. So मॅडमचा खूप महत्त्वाचा मुद्दा असा की आम्ही खुबशे कॅन्सर जे म्हणतात ते जन्मजात आसनात तर आमची जीवन पद्धती किंवा जीवनशैली हाचेरसून ते ठरतात. त्या खातीर आमची योग्य जीवन पद्धती आसप, आमचो एक्सरसाइज, आमचो डायट, जो आमचो आहार घेता ताचेर लक्ष आसप. त्या पद्धतीन जर सगळ्यां पद्धतीन जर आमी योग्य पद्धतीची जीवनशैली जर आपणायली तर आमी कॅन्सराचेर जय जोडू शकता. तिसरी गजाल, कॅन्सर म्हणजे फक्त डॉक्टरांचं प्रिरोगेटिव्ह ऑर ओनली डॉक्टर हॅज टू ट्रीट कॅन्सर. इट इज नॉट लाईक दॅट. एव्हरीबडी हॅज टू जॉईन हँड्स, right from the teacher, farmer, pesticides what we are using, how we are storing, right from our refrigeration, microwave and whatever you are using, at every point of juncture we all have a role to play. आणि ह्या खातीर जसे मॅडमीन सांगला की तुम्ही दिसभर फक्त बसून किंवा असे आळस पडून काम रावनासतना चलप, काम करप, एक्सरसाइज करप, मेडिटेशन, योगा हे सगळ्यांचे महत्व आसा. Doctor, one more thing. With the changing trends, what we have found or we are seeing that some newer vaccines are coming. How promising are these vaccines in today's world as far as when we are looking at the cancer, and which cancers you think can be prevented because of this vaccination program which is taken almost to the country now?
Yeah, a very important question. See, first let me acknowledge there are only few cancers which we can pick up very fast with screening. And one of them is cervical cancer. And cervical cancer in women is actually a cancer of their female genitalia. And most of the time we have seen that cervical cancer is associated with the infection of HPV, which is one of the viruses. And what we know today, if women early in their life, which means when they are girls, when they are in the early reproductive age, if they can get a prevention against this virus, then chances are that they may not develop cervical cancer later. And that is the principle of the vaccination for the HPV against cervical cancer, which means you are already increasing the defense mechanism by generating antibodies against that virus, that tomorrow it may not lead to cervical cancer associated with HPV virus. And that is why HPV vaccine is very important for prevention of cervical cancer. And if you would see, just last year, the government of India has also announced that now HPV vaccine will become part of the universal immunization program.
Correct.
That means it will be provided to all young girls before they attain active sexual life. If they take it before that, then there are very good chances that you can prevent the HPV infection and later on cancer. So wherever these vaccines have proven efficacy against those viruses that cause cancer, we can definitely take cognizance of that and use vaccines for those prevention of cancer.
Okay, just an academic twist. Actually, I don't know whether it is worth asking you, but sometimes they said some vaccines have come from abroad, they are supposed to be more effective than this. Is that something like that, or they are all equally effective? See, whichever has come in the market.
I see there's a lot that I believe it takes to really bring in innovation in the world. And a scientist or a company that has really put money and effort to prepare a safe, efficacious and quality vaccine will definitely be a better. Now, if within India also, if we have manufacturers who can assure that safety, quality, and efficacy as per the standards
Standard
laid out by
guidelines.
the regulatory authority, then they could be equally effective. But a lot depend on the clinical trials that they have done, the safety profile of the vaccine, and the efficacy that it is showing in the real world also. So it's very important to look into that scientific details before making that claim.
Acha. Okay, another twist over here. Sometimes, recently somebody said that this, since we are talking about cancer, CS cervix, the vaccine can be given or should be given to the boys also or to the males. What is the exact significance? You think there is any significance, any role over here, or they should become with some different vaccine, or they are likely to come? Because in between, I don't know, as I said, WhatsApp University comes with some all newer information.
See, first of all, I also want to inform all the viewers that please don't be a Google doctor. The reason is that everybody who believes that Google is giving you all the right information, let me tell you, it only has information from 0.1% of world's population. 99.9% of world's population is not putting information on Google. So first of all, trust your doctor. Because he has spent 7 years, 10 years, 13 years of super specialization to understand human body, which is still known as 2%, right? And then that is why all these informations, there's a lot of fake news also. So I think where this, as of today, we don't have any scientific evidence to say that if you give the same vaccine to the males, then it may impact prevention in the female. But the idea is that if the woman is already exposed to the HPV infection, then no matter whether the guy gets the vaccine or the woman gets the vaccine later, it's not going to help.
Achha. Okay, doctor, now one more very important question. Nowadays, at least in Goa, we have started on a massive scale. We are coming with a lot of screening camps and all. How far you feel the significance and how people should also take equal part? Because sometimes people are, though the camp is there, everything is provided to your doorstep, but we are lethargic. Forget it. So that type of attitude has given not that much desired results. So in view of this, I want your opinion, and especially because we are talking about this, as you have rightly said, breast cancer, cervical cancer, which can be detected at early stage. Breast cancer, as you rightly said, की मॅडमने सांगला की जर तुम्ही स्वतःची ब्रेस्ट तपासून पाहिली दर महिन्याच्या उपरांत जाल्यार तुम्हाला स्वतः कळू शकता. And what I have observed, one more thing, madam, since this breast cancer and cervical cancer are at higher risk, because it doesn't pain. So whatever doesn't pain, the lady feels it doesn't pain. Okay, it is there. She feels something. So she feels that is some discharge, abnormal discharge, but she doesn't go to doctor. And no, as you rightly said, she's busy with the family life. And then either she's shy or she doesn't want to go because it doesn't pain. If it was a toothache, she would have gone to the doctor. So here I want your comments on this.
Sure. And first of all, again, I would like to reinforce that breast cancer is very, very much treatable today. Because of so much of scientific advancement that has happened, the medicines that have come. The catch is, the sooner you are able to diagnose it, better you will be able to save it. Second message that I want to give is that please do not be scared of screening, because that is your best chance. Most of the time people live with a taboo, and women especially, that if I have cancer, if anyone gets to know, my children may also get it, because it is something like a passing in the generation. No, not all cancers are passing in the generation, but chances are that if you get yourself screened early, you get correctly diagnosed early, and you initiate your treatment early, 99% of breast cancers are very much curable, and women are now surviving for more than 20-25 years.
Absolutely.
So that is why it is very important for women especially to get themselves screened for breast and cervical cancer. And Government of India has really come up with this program, and I know the state of Goa, Health Minister himself has initiated screening last year for almost 100,000 women. That is a very big leap. And that is why it is very important that get yourself screened, and especially after age of 30 years, it is very important to start doing self breast examination. Any discharge from the breast or nipple is abnormal. Any kind of lump requires further investigation. It could be benign. It could be just any hormonal change leading to benign disease of the breast. But it is important to get yourself tested. Any redness, any puckering of the skin could be a sign of imminent cancer. So don't wait for pain to come in. I think anything if you feel is abnormal, at least it requires an inspection from the doctor. So please visit your doctor, and in fact you will save your family much more, because cancer does not happen to an individual. It's always the family which is involved. It is always about who is going to look after the finances.
Correct.
Because it could be a long treatment. It could also be about who's even going to look at the lady's nutrition also.
Correct.
Right? So it is a problem of the family, and that is why if all of them can come together early, get her diagnosed early, initiate the treatment fast, take care of her nutrition, take care of mental well-being, because half of the battle is won in the head. The moment you resolve that I will beat cancer, 90% chances are that you will beat cancer.
Correct.
So please don't get stigmatized, don't be under taboo, get yourself examined, and especially after 40 years, women should get 1 year, mammography done every year, just to see any lump, if it is about to be formed or anything which is abnormal, it can be picked up faster.
सो जसे मॅडम सांगला की एक साधं म्हणजे मुद्द्याचे तितकेच सांगता हांव की जसे स्क्रीनिंग कॅम्प्स असतात, जसे स्वतःचे आपण एक्झामिन करप, त्याचप्रमाणे स्क्रीनिंग कॅम्प्स असतात किंवा ते डॉक्टराकडे वचून डॉक्टरच्या सल्ल्यानुसार मॅमोग्राफी करून घेवप गरजेचें आसा. आणि स्पेशली जेन्ना तुम्ही एक 30 वर्सां 40 वर्सांची पिराय जाली का डॉक्टराच्या सल्ल्यानुसार जे डॉक्टर सांगता त्यो टेस्ट करून घेवप, जाका लागून कॅन्सराचे समजा कितेंय लक्षणां दिसून आयली किंवा चिन्हां दिसून आयली जाल्यार तुमी बेगीन पिकअप करतले आनी बेगीन बरें करूं येता. आज ताणें सांगलां की आज कॅन्सर म्हणजे अशें भिवपा सारकी गरज ना. एखाद्या मनशाक जर जालो जाल्यार तेची जर बेगीन तपासणी जाली, बेगीन जर ताचें निदान जालें जाल्यार 100% ऑलमोस्ट 100% क्युअर करूं शकता आनी ती मनीस किंवा तो मनीस आयुष्य नॉर्मल जगू शकता. सो अशा वेळार म्हाका दिसता दीस अ रोल ऑफ एवरीबडी की जशें मॅडम सांगलें की इट इज नॉट जस्ट अ इंडिविज्युअल प्रॉब्लेम, it is a problem of the family, but I'll go one step ahead. It is not the problem of the family, it is a problem of the society also, because everybody is involved.
Yes.
Finally, one good teacher example is teaching so many students. If by chance something happens to the teacher, so many students are affected.
True.
So ह्या प्रमाणे एक बरो दोतोर, बरो इंजिनियर कोणूय असू तो, खंयच्या व्यवसायातलो असू, ह्या सगळ्यांची एक सामाजिक बांधिलकी असता आणि समाजाच्या नेटवर्कान आमी सगळे म्हणजे बांधलेले असतात. तेन्ना प्रत्येकाची काळजी घेवप, प्रत्येकान घेवप आणि समाजान तितकोच आधार दिवप. Rather than when society comes into picture, they should be also support you rather than saying, you got cancer, असे करनासतना you have to be more supportive की बा ना बरें जावं शकता. As madam has rightly said, today we have got so many newer medicines, newer technologies, so many things are happening, robotic surgery, targeted therapy, and so many new things are coming. Every day something new is happening. So then don't be biased, follow your doctor's instruction, take right treatment, right approach, and right screening time is also equally important. Go do your medical checkups regularly. जसे तुम्ही तुमचा बर्थडे सेलिब्रेट करता, as people celebrate some this thing, as you have rightly said about CA service, we can go for pap smear, तुम्ही टेस्ट करू शकता, तुम्ही मॅमोग्राफी करू शकता. ह्या सगळ्यांनी तुमच्या सगळ्यांचे आरोग्य आणि समाज बरो जावप, समाज बरो जालो जाल्यार राज्य बरें जातलें, राज्य बरें जालें जाल्यार देश बरो जातलो, सुदृढ जातलो. ह्या खातीर सगळ्यांचे जसे आमचे प्रधानमंत्री आरोग्य योजना आसा, गोंयचे आमचे DDSY आसा, सो ह्यो सगळ्यो स्किम्स आसा. ह्या खातीर की कोणीच म्हणपा जायना की पैसे नाशिल्ले म्हणून वी कुडंट टेक द ट्रीटमेंट, बिकॉज ऑल दीस फॅसिलिटीज आर प्रोवायडेड बाय द गव्हर्मेंट विथ द सिंपल ऑब्जेक्टिव्ह. ऑल द फॅसिलिटीज शुड बी अवेलेबल irrespective of their financial status. Doctor, one more thing I want to ask you. When we are talking about this cancer, what are the early or warning signs and symptoms you should be really alert, or I will say a red flag?
Yeah, for any cancer, and this is not related to breast or cervical,
whatever you feel.
some are very telltale signs. If someone is losing weight very rapidly, maybe around 10% of your body weight in less than 1 month, that is a telltale sign. If you have loss of appetite, कि आपको भूख ही नहीं लग रही है, despite the fact that you've not eaten anything, but you're losing your appetite. If you have, like I said, any abnormal blood discharge from any of the parts of your body, any lump in any part of the body which is not healing or turning red, or ulcer is coming out and it is not healing, and other symptoms, these are at least some telltale signs that there is something which is going abnormal in your body that requires let's say further investigation. But if you go specific to certain cancers, like I said, for breast I have already mentioned, for cervical also, if women who are in a post-menopausal age and still have some bleeding happening through their female genitalia, or if they are having any kind of unusual discharge which is not getting treated, or any kind of wart which is not healing. These are also some of the telltale signs. So I think very important, like I said, is that you know your body, and your body will always give you signs.
Correct.
Do not ignore it. That is the
Absolutely.
point. Do not ignore it. Anything you feel abnormal and which is not healing, let's say cough, especially in lung cancer, you have dry cough for more than 3 weeks, you have taken antibiotics, it is not getting resolved, or you have blood coming in your spit also. It could be tuberculosis, not necessarily that it will be cancer, but it requires investigation. So these are few of the telltale signs.
सो डॉक्टरान सांगलें की आमी जेन्ना अशें केन्ना तुमकां दिसून येता की खंयचे आंगांतल्यान किंवा नाकांतल्यान रगत येवप, तोंडांतल्यान रगत येवप, संडासांतल्यान येवप किंवा मुताच्या वाटेंतल्यान येवप, बायलां खातीर दादल्या खातीर इग्नोर करनाकात. ते दुखना म्हणून डॉक्टरा कडेन वचनासतना रावूं नाकात. डॉक्टरा कडेन चलात, ताची पूर्ण तपासणी करून घेतात, ताचें निदान करून घेयात. लेट इट गेट डायग्नोज प्रॉपरली, इवॅल्युएटेड प्रॉपरली, बिकॉज लॉट ऑफ ट्रिटमेंट मॉडेलिटीज आर अवेलेबल. केन्ना केन्ना समजा तुमकां सांगलें डॉक्टरान की आतां कॅन्सरची फर्स्ट स्टेज जाता, एकदम गरबगडीत जावं नाका. डोंट गेट डिसहार्टन, because as you rightly said, lot of modalities are available. I want you to just, since we have got another 4-5 minutes, what are the modalities of management of cancer available in today's recent with changing trends in medicine?
Yeah, very important. So whenever we treat a cancer patient, we bring in the surgical aspect because it may require surgery. We bring the medical oncologist because it may require medical intervention. And we also bring radiotherapy, which is very targeted. So it's always a multidisciplinary approach where you get a surgical, medical and radiotherapy unit coming together. Now, as I was talking about newer therapies, we have come down to a point that we know how these cancers are responding to certain factors within the body. It could be certain hormones also, it could be certain growth factors also. Now we have gone down to a level of precision medicine that we exactly know with certain tests, we exactly know which particular factor is leading to for additional growth or breeding of this cancer. And medicines have come to that level of expertise that we can target that particular receptor and we can provide specific therapy, which means only the cancer cells will be damaged and it will not cause harm to rest of the body. Because earlier people used to think, oh, chemotherapy is very difficult because of the side effects. Now with newer targeted therapies, the side effects have also minimized. And even with radiotherapy, we have come down to a point where we can exactly provide radiation to that particular targeted abnormal growth of cells. And the newer thing is now we even have vaccines like subcutaneous injections where you just need to, like an insulin, people use a pen to take insulin for diabetes. We have injections like this for breast cancer, for lung cancer, where you don't need to even get admitted in the hospital. You come to the hospital, take this 15 minutes subcutaneous injection and you can very well go back to work. So that's what I'm trying to tell you, that science has advanced to this level that sometimes you may realize that how can cancer therapy could be so easy also. So important is, do not fear, because like I said, half of the battle is won in your head. Go to the doctor and ask for the right treatment, get the right targeted, your genomic testing done also, know which receptor is harming and have that targeted immunotherapy for your cancer treatment also.
सो ही खूप महत्वाची गजाल आशिल्ली की आज जशें सांगलें की सायन्स इतकें एडवान्स आसा, मेडिकल फील्ड इतकें दिसान दीस फुडें प्रोग्रेस करत आसा, नव्यो नव्यो थेरपीज उपलब्ध आसात. पयलींच्या सारके किमोथेरपी जातले, सगळे येतले त्रास जातले म्हणून तशें गरबगडीत जावं नाका. आज टार्गेटेड थेरपी आसा, किमोथेरपीतली इतकी नवी नवी वखदां आसा, दे एक्ट ओनली ऑन द सेल्स विच आर डॅमेजिंग ऑर विच आर कॅन्सर सेल्स, बाकीच्यांक काय करना. परत हांवें आतां सांगलें की पयलींच्या सारकें हॉस्पिटलांत एडमीट जावपाची गरज ना, तुमी सबक्युटेनियस एक इंजेक्शन घेवन परत घरा वचूं शकता. अशा पद्दतीचे नवे नवे मॉडेलिटीज आसतना कांयच भिन आसतना म्हाका दिसता तुमी सगळ्यांनी जर एक ह्या जैतान ह्या झुजान जर वांटेकरी जाले विथ पॉझिटिव्ह मायंडसेट, डेफिनेटली वी कॅन कॉन्कर ओवर हियर अँड डेफिनेटली वी कॅन लूक फॉर अ ब्रायटर फ्युचर फॉर दीस स्टेट अँड फॉर द कंट्री. ह्याची कार्यावळ सोपयतना मॅडम, थँक्यू व्हेरी मच फॉर स्पेरिंग अ प्रेशियस टाइम. यू केम ऑल द वे फॉर अवर प्रोग्राम. थँक्यू व्हेरी मच. सो नाईस ऑफ यू. गॉड ब्लेस यू.
Thank you.
नमस्कार.
Thank you.